Mr. Nazim, how have you benefited from the Common Market Protocol?
Well, I would say that currently most of the things are still work in progress. So today we're not getting a direct benefit, but certainly when the harmonization is completed, we see a lot of benefits. Let me give you an example. Today, if we want to launch a product in Uganda, in Kenya, in Tanzania, we have to submit separate registration files for the same product. So there's a lot of work required because every country is going to require a slightly different format of the registration file. Now, registration files for a pharmaceutical product is thousands of pages. So it's a lot of work, and it doesn't make sense that we supply one batch to Uganda, a slightly different format to Kenya, and yet another format to Tanzania. So I know that in the harmonization exercise, when it's complete, we will be able to just submit that file to one country, and we will get approval in the whole of East Africa, which is very similar to what happens in Europe now. In the European Union, you apply through one country, and if you got approval through that, you get an instant approval process throughout the region. So that means then we will be able to promote the product on day one in all the 5 countries. That will be a tremendous help. But we are several years away from that.
Can your generic drugs compete with the big brands in East Africa?
So, for instance, our paracetamol, which is our biggest volume drug, is called Camadol. Can Camadol compete? Certainly it can. Certainly it can. Sure. I think what I'd like to stress is that people have to understand that pharmaceutical manufacturing is very heavily regulated. In Uganda, we are fortunate that we have the National Drug Authority, which is a very strong authority. They keep a very close eye on us, they regulate us, and make absolutely sure that any product that is coming out of our factory has reached the right quality standard.
Is government now giving enough support to the local manufacturing industries, especially you who is dealing in the pharmaceutical industry?
I think the prime support we're looking for is really a price preference in tenders, because the majority of our products for the public sector are bought through tendering, and because it's an unfair, unlevel playing field, we are saying, look, give us a 10 to 15% price preference, which is, by the way, what Kenya and Tanzania do. Once we get that, we are hoping to be much more competitive. So I would say the government is definitely a strong partner, and they're beginning to now realize that they need to support the industry. Otherwise, frankly, the industry would die because because we compete globally. As I'm sure you're aware, that about 90% of the products that we consume in Uganda are coming from outside of our country, mostly from India, increasingly from China. Both those countries give subsidies to their companies. So on one hand, we've got imports coming in subsidized, and yet we are not being supported enough yet. So it's an unlevel playing field. So the competition is not fair.